Oh, snaps!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet.
Well, hello, raw feeders. DeDe Murcer Moffett, CEO of Raw Dog Food and Company. Where your pet's health is our business, and we're friends like my friend Dr. Andi. Don't let friends feed kibble. What is happening in paradise today? It looks a little windy up there.
A little windy outside, a little windy, a little disheveled if you.
That's all right. That's all right. You do lousy outside. I like it outside. It's nice. It's open. It's fresh air. You know, do you find that the dogs are loving it, or do they care?
I think they like it. I think my regulars are like, don't we go in the door now? We should go in the door now. And they're like, no, we're going to do it here. And they're like skeptical, but then they're like, ooh, I can sniff the wind and sniff this spot and look over here. And they're all real good.
Yeah, I think it's good. And then you can also tell when it's time for you to get out of there because somebody else is coming down the driveway. It's like, my turn.
It's a little more obvious, isn't it?
Yeah.
Yeah.
Okay, so hey, I want to ask you a couple of questions about chiropractic because I mean you are a chiropractor, right? After all. And again, Dr. Andi, I think what you do is so important because what I'm learning on the people side it goes right over to the dog side, and that is alignment. When the body is aligned correctly, less likely for things to go wrong. Okay.
Yes.
Now I'm going to say, what you put in your dog is very important. However, how your dog is aligned is incredibly important. But one of the things that we don't talk about very often is muscle spasms. Okay. So I know that when I've had a muscle spasm, Dr. Andi, I feel like you're like, oh my gosh, I've cracked a bone. We don't really understand how to separate what a muscle spasm might look like in a dog versus like a sports injury or something even more severe. And I think the other thing that I'm learning is that we got to be smarter. We got to be smarter. And here's why. Because it do seem like to me that things are being treated incorrectly in a lot of ways. And that more harm can come to people and pets when we are really not aware of what health is or what the issue is. And, you can cause all sorts of problems. So all that just to say, a dog may not have like a disc out of whack. It may just be a muscle spasm, right? Yes. And so how can we tell if it's an actual that than this?
That's a great question because I see it quote unquote misdiagnosed all the time. Your pet tried to jump in the car, they missed it, they're not moving very well. They're 10 p.m., midnight, they move after they fall asleep, they start screaming. How many pet parents run off to the ER at that point? And you go in and you hand over all of your trust and knowledge to a professional who is supposed to know better. They don't always.
Come on, say it in. So
I don't always, right? You should question everything. But yes, they generally in the veterinary medicine, musculoskeletal world, they're like, oh, it must be a disc. You need to go to neuro. You need to go see a neurologist. Okay, it's on the list. I have a list in my head when I'm seeing an animal. It could be this, it could be this. This one's way low, this one's way high. I have a list because we have no guarantees on the diagnosis, especially when you're dealing with a critter who doesn't use words to speak to us.
Right.
So it has to be a sliding scale of what's going on. And I think veterinarians in general do a lot of disservice to pet parents by going, oh, it's got to be a disc. Let's take an x-ray. Oh, you see this decreased disc space between these bones. It's got to be a disc. Well, we've talked about this. What the heck is a disc? What does that mean? That means it's a structural component of the spine. It cushions between the bones of the spine, but has it herniated? Is it just leaking? Do we have some inflammation compressing a nerve? Do we have that muscle spasm involved? And it's not an actual true neurological disc herniation that requires surgery. Can you tell that right off the bat? Sometimes, sometimes not. And sometimes is if your dog cannot urinate or cannot hold their urine, you have a more serious issue going on. You have a more serious neurological issue. You most likely do have a herniated disc. That most likely does require a trip to the neurologist.
Okay,
and possibly surgery.
So when the dog can't pee, that's a sign.
Or is peeing and doesn't know they're peeing. It can go either way. It just depends on what part of the nerve is being impacted by the disc herniation. But it's usually a lot of noxious inflammation going on. It is really impacting the nerves. And that generally does need to be fixed ASAP.
Okay, so
surgically.
But is that, let's say it like this. Are there other reasons besides that the dog needs to have some type of surgery on the back if they are peeing? Like, I know some dogs.
Yeah, so we could go into why we're incontinent. There is just generally, usually spayed older females have incontinence. Some older dogs will get incontinence. And that can be a sphincter issue, which is also a neurological issue that could respond to chiropractic if there's no other clinical signs and symptoms. If you have usually these dogs that are not peeing or cannot tell that they're peeing are also having pooping issues, and they're usually not walking in the rear end.
Okay. So that makes a lot of sense.
You stack it all up. Now, if the dog knows when they need to go potty and you can get them out there, but they're not walking, that could still be chiropractic if you're patient enough. Now, back to that dog that moves in sleeping at midnight and they start screaming their full head off, that's usually a muscle spasm.
Okay.
Shockingly enough,
go ahead.
It's usually just a muscle spasm.
Yes, it's like I can see where this would be very confusing, and I can see with what you said that you could end up doing a surgery you never needed to do.
Yes.
What's a surgery like that cost, you think?
Between $5,000 and $10,000.
Okay, now.
And then you have, if there's any complications, and then if you do the PT afterwards.
And do you know if you get in on Dr. Andi's birthday bash, adjustments?
Yes.
That's less than $1,000 a year. Okay. So you're going to spend $5,000 to $10,000 to do a surgery that you don't need. This is why you need people in your team that really understand what's happening with your dog, because we as pet parents hear this screaming, right?
Yeah. It's intense, right? It's the middle of the night. This is your child. We've got to go somewhere. We've got to fix this. And then they scared the ER generally will scare you even more. Unfortunately, my personal opinion, what I've seen over 21 years, they usually give you the wrong medications to help it too, until you can even go to that neurologist or that chiropractor or the next step.
You're saying like gabapentin?
Well, they do that. But they we'll go back to gabapentin. It's my favorite. I'm kidding. They usually will do an NSAID. They really be needing to do a steroid.
Okay.
And they rarely ever give you a damn muscle relaxant. It is sometimes like pulling teeth to get what's called methocarbamol or Robaxin out of your veterinarian for muscle spasms.
What's another name? Is there another name for Robaxin?
Methocarbamol. Those are the only two I know.
That's it.
Metho,
Meth-
carbamol.
Carbamol. Okay. And that is just a muscle relaxant. So,
yep, it's the same stuff people get.
okay, let me ask you this question. So we have a dog that wakes up screaming, not walking.
We're going to do both?
Well, no. If he was having a
you can do both.
No,
sometimes it goes together, but usually they're walking. If we're we're going to go with just the classic cervical neck pain. They usually move after falling asleep about midnight, screaming their full head off. They're usually still walking.
Okay.
Generally speaking.
This is how we're going to tell if it's a muscle, muscle spasm.
Yes.
Okay. Yes. Walking, going to sleep. Why does it happen like at midnight? What's the deal?
My guess, my theory is, let's say you went on a 3-mile hike and the dog slid a little bit on a little walk, and you came back and they had dinner and then they laid down and then they fell asleep and those muscles all tightened up.
Okay.
Same thing has happened to us, right? We've tripped over a step and we caught ourselves and we're like, oh, okay. And you go about your day and you finish the dishes and you eat dinner and you lay down and then you try to get out of bed to go to the bathroom in the middle of the night or the next morning and you're like, OMG. I've had
a man, and muscle spasms are no joke.
My back seized up. I was standing still. I was watching dog agility. I wasn't even working at the time. And it went click and I went, this is not going to be good. I knew it. Muscles are a really big deal and they are rarely ever discussed in veterinary medicine. And I don't know why. Don't know why. Huh?
You know why?
I do.
Well, yeah, because that's too easy, man. You got to do surgery.
Well, yes, there is that. But it is fascinating that, it's got to be arthritis. It's got to be a disc. It's got to be they blew a tendon. They all of which require surgery instead of, these muscles are really, really unhappy and they make me miserable. They can make your dog miserable. Especially when it's in the neck. It will drop your Danes and your Chihuahuas down and there is screaming and they can't lift their head and they can't look a certain way. And it's a big deal and it's frightening for pet owners. And sometimes you do have some disc issue in there. But again, let's get the proper meds on board. If they respond to meds, you are golden. It just takes some time to heal up. And chiropractic is going to help that heal up so much faster.
So we got a dog. He's screaming. Okay. Now, the question is always with pet parents, I think, do I need to do something right away? Am I causing more harm if I'm not doing it? All right. So let's just say that we've got this animal who is waking up at midnight. He was walking till he went to bed. Now he wakes up and he's screaming and he can't do some of those things you were talking about.
Comfortable. Yep.
There's no muscle relaxers there in the house. Okay.
Honestly, what pet parent is not going to go to the ER at that point?
Well,
even after listening to us.
Well,
but it's going to kick in, right? The nervousness is going to kick in. That anxiety is going to kick in. I've got to do something about this. Plus, I don't have anything in the house to give them. And so, 90% of pet parents are going to go. But ask for a steroid, ask for a muscle relaxant. If you can't get out of there with gabapentin, just take the darn stuff with you. But when you have any kind of neck pain, the prednisone, I think, is a miracle worker for getting the inflammation down, getting the inflammation off those nerves, and then that also gives you that information. If they respond to that, this supposed disc issue most likely will heal up without surgical intervention.
And how long should you wait?
3
So
days
let's
tops.
3 days. Okay.
Like you should see something in 3 days, if not sooner, with prednisone. Especially if you can be well educated and you have a suspicion that this is what's going on, and you get that pred injected by that veterinarian. They can inject.
So let's say this. Now, if it were me, Andi, I would be like, I'm going to take the I may go, if I have a dog screaming, but I'm probably going to have a muscle relax in here anyway.
Yeah.
You have a choice as a pet parent. I don't think you feel like you have one when you walk in, right? Or even when they're talking to you. But I would say, well, I'm going to go the conservative route first.
Yep.
Okay. This is what I want to try first. I don't want to immediately go to, other meds that might be damaging, or other protocols that might be damaging. So you have to make a call, you have to make a decision. But if I know, and so this is sort of a statement question to you, if I know that I'm not putting my dog in harm's way, okay, because I'm only going to wait 3 days, and I'm going to take this steroid or muscle relaxer, and I'm going to see what happens in 3 days, right? I'm not putting my dog in harm's way doing that, right? Even if it was a disc issue.
Generally speaking, no. How are you going to, sorry, let me back up. In our area, are you going to get in to see a neurologist before 3 days anyway?
Right.
It's going to be hard to get that appointment even sooner than that anyway. But you want the right meds. And it's not your non-steroidals. It's not your Rimidils, your carprofens, your vetprofens. When you have the screaming animal and suspected neck pain, you ask for steroids. You tell them you heard it on a darn podcast, but don't tell them it's from a chiropractor. Tell them you had a friend. Make up something that, or tell them your animal's allergic to NSAIDs and they can only take steroids. Educate yourself and then come up with something that will be easy to work with who you're working with.
Okay, so you guys, listen, you could say Dr. Andi, because they're going to just, you don't have to say Dr. Andi, the chiropractor, although they should, respect that. But, so understand this, what you're trying to do is get the inflammation down. If there is any, is there inflammation when we have a muscle spasm? Is that what it is?
There's always inflammation.
Okay.
Always.
Okay.
There's inflammation with a disc, with a muscle spasm, with a torn ACL. That is how the body starts to buffer the area and handle the healing. It causes inflammation. Sometimes that inflammation that the body requires is the problem. And so we need to get that out of there. And steroids, prednisone is the only thing that reduces inflammation in the spinal column.
Wow.
And these don't work in those cascades. Only prednisone. It's old, it's cheap, has ugly side effects, but we know it works.
And has ugly side effects. We don't like those at all. We don't like those. But 3 days.
You should see something. It doesn't mean your dog's not on it for a week to 3 weeks. My book, what I've worked with other veterinarians, and namely dachshunds that stop walking in the rear end due to disc stuff, 3 months if you want to avoid surgery.
Yikes.
And you're slowly backing down, and you're slowly adding in other stuff, and the body's slowly healing. But yeah.
Okay. Wow. All right. Good reason to work with Dr. Andi. If you have a dog that has gone through this, or you've gone through this and you're confused, the suggestion of surgeries on the table, let's get another opinion. Okay. And Dr. Andi, I know you're super busy, but if somebody said, I gotta talk to you like within the next 3 days,
I talk to them.
Okay, there you go. There, she said
Yes.
it.
Especially if it's, I need to decide about surgery.
Right.
Yeah.
Because
It's a big deal. It's a
right.
big deal.
And she can give you the questions to ask, and also she can ask you the questions to get the answers to give you the best advice. Okay. Now, Dr. Andi, if they want to reach you, you're doing this change, add, mix, something. What's happening here? You got another website coming up.
I do.
Where would they go to you to do this and that?
To do consults, you need to go over to everwellpets.com now.
Spell it
EverWell.
just like it sounds.
Yes, pets.com. Everwell Pets.
Okay, everwellpets.com. And that's where you can sign up to work with Dr. Andi. What's going to happen to animalmagiccare.com?
It'll stay here in Denver. And if you're in the Denver area and would like some hands-on chiropractic care, that's where you go, is the animalmagiccare.com.
Okay, so this is sort of like my out-of-state people and my in-state people, or is it what?
Kinda, yes.
Yeah. Okay.
Yeah, it's always been important to me to grow a community. And I finally found a business partner that could handle all the backside things. All the website buildings, all of those things that I'm not any good at, nor do I have any interest in or the time for, while I'm in front of clients. And so we kind of came together. She's like our perfect client, DeDe. She's like, doesn't know a whole bunch, but is willing to do anything.
Oh, okay.
Right?
Easily trainable.
Not that interested in centralized traditional vet med, is looking for other things, but just doesn't know the biology, doesn't know what the body should or shouldn't do, but is willing to do all these things and has a lot of common sense. And so she's been great, because I forget what I know. And so I start spewing things out, and she's like, I'm not following. I'm like, good, I'm glad. Now let's back it up so we can get to where you can start following, right? Because we get so far ahead of ourselves, and we talk about it, right? Feed raw, just go get some stuff and put it in the bowl, you're fine. Right? And that just freaks people out, right? No, I need to know the why and the how much, I'm like, yeah, really. And then after experience, those people will be us too, right? Just throw some stuff in a bowl, you're fine.
Because Andi, don't you eat processed foods every day?
No.
I mean, it's really that simple, but I don't think that for some reason that just doesn't compute, right? And so I get it. People making it really, really difficult out there, right? They're making it really difficult. Balance every single vitamin and mineral. And I was listening to somebody the other day, and it was like, do we really need to know how much like ascorbic acid or all these different kinds are actually in an orange? Do we really need to dissect an orange down to the nth degree? Does it matter?
And then
it's real freaking food.
Right. And then you can't even do that because all those components work together synergistically that can never be made in a lab.
No, never. Don't even get me started on making things in a lab. I mean, doing all these deep dives into all the things they're making in a lab make me crazy. Mm-hmm. But okay, so it's called Everwell Pets. Where your pets will be. Everwell Pets. Everwellpets.com. Yep. And again, I really, in people, osteopaths, chiropractors, acupuncturists, all craniosacral massage, all of these are body work, right?
Yeah.
Nobody spends a lot of money on their bodies. No, I mean, some people do, right? That really understand health. And it's so important. If your body is going to flow, right? If the hydraulic fluid is going to flow, whether that's in you or in your pets, you got to have them aligned. You know, how many problems do you see from a dog? And I know you got to go, but a dog that has been out of line, Dr. Andi, for 10 years. Their pet parent didn't know there was a
Yep.
chiropractor like you around.
Yep.
And don't you see everything's compounded? Oh, that was out, so now that's out,
Yep.
now that's out, and that doesn't flow. And
Yep. Yeah. And every visit we get something a little different. Well, why is it doing that? I'm like, I don't know. But it's changing. We're shifting. We're picking up toys. We're going upstairs again. Like it, oh, they stopped doing this and now they're, doing their spins again. And you didn't even realize they stopped. But it's layer after layer after layer. And it still amazes me. Sometimes I do a lot and we get a little return. And then sometimes I do a little and we get this huge big change. Because what I put into the body decides what to do with it.
yeah, that's another thing that I'm learning. Our bodies are really, really very intelligent. And it's amazing to me that they continue to work with all the abuse that we put them through.
It's amazing.
We don't
Like,
we don't feed them right,
Nope.
starve them, poison them,
Mm-hmm.
kick them to the curb.
Yep. Ignore them.
Yeah, that's a good
Yeah.
one. Ignore them. You're like, yeah, my body, is out of line and blah, blah, blah. I was talking to my mom today and she was, she's been dealing with this vertigo, which she's
Mm-hmm.
getting over, but now they're testing her balance and she's just like, I don't understand, and I was trying to explain to her this hydraulic system. And I'm like, Mom, if you don't walk, if you don't move, that hydraulic system in your body doesn't work. I mean, it works, but not like it should, like pumping everything up and down, right?
Yep.
Which is,
and with age, all of that gets stiffer. And so you have to
don't
work.
I know it?
You got to work harder at it. Like a 2-year-old dog does not feel like an 8-year-old dog that doesn't feel like a 12-year-old dog. They all feel different and we try to optimize them for where they're at. And that's also part of just experience.
Right.
But
I
that
do.
hydraulic system gets
Yeah.
harder to pump that stuff around and you got to keep moving.
Yeah. And one of the things that I'd like to understand in dogs, because we're, vertical, they're horizontal, right?
Mm-hmm.
Where the diaphragms are in the dogs that pump that hydraulic fluid.
Mm-hmm.
Because in the people, there are actually 5. So you got 2 in the head, 1 in the thyroid, 1, where we all think about the diaphragm, and then 1 in the pelvis area.
Yep.
All of those working to pump that fluid. Where are they in the dogs? Do you know?
They have 4. So upper cervical, thyroid area, somewhere in there, right between their shoulder blades. So right where the cervical spine meets the thoracics. Again, the actual diaphragm, and then again in their pelvis, like us.
Wow. So we have one more than that. Yeah,
Mhm.
that's so interesting. And maybe we can dive a little bit more into that at some point about how a dog should move, because there's this walk that Rick and I do,
Mhm.
and they call it the sexy monk or the runway model, either one.
Okay.
And
Yes, I am familiar with the runway model. Okay.
So, but the sexy monk just sounds
Yeah,
funnier.
that's
But
awesome.
anyway, you wouldn't think that you would walk that way, but it's like putting one foot out and that shoulder goes to that opposite, right? Not
Mhm.
like, but it actually moves that spinal cord. It's like a pump.
Mhm.
And we learned this through the Bigglesons, and then there's the Chi machine and stuff like that. Things that can really move your body and get those hydraulic fluids going.
Mhm.
But when I'm looking at a dog, I'm like, they got 4 legs.
Yes.
And it seemed like it'd be a little bit harder for them to get that hydraulic fluid going like we can. Does that make sense? I don't know how
It
they would
makes
do it.
sense of what you're saying. I don't know if it's any harder. They have 4 limbs to throw in there, and then they're much smaller.
Huh. Yeah, it's one of the things that I really want I want the Bigglesons to work with me on looking at the blood like they do in the people underneath and looking to see what those dogs' blood looks like. Because I really want to see the blood. What does the blood say on a kibble-fed dog? What does the blood say on a raw-fed dog? What does the blood say on a kibble-fed, highly vaccinated flea and tick heartworm? Right? Because that blood changes a color and it shows poisons and stuff like that. And what does it look like on a completely clean dog? And I know one of your other,
fascinating.
yeah, and one of your other passions is EMF and circadian rhythm, but EMS would fall in this category a little bit as well too. But it's something that I'm talking to them about, and I'm hoping that we can take a look at that, right? Because today I really want to try to substantiate the stuff that we think with actual controls.
Yeah,
That
would be awesome.
Yeah.
Yeah.
So that may be coming up. And getting the super clean dogs is going to be maybe a little bit of a challenge. We'll see.
Might be. I think we could wrestle some up.
Yeah, a few.
I think
All
they
right,
exist.
right. All right, everybody, get over to everwellpets.com, just like it sounds, everwellpets.com. And I'm sure that if you get over to animalmagiccare.com, you'll have a link over to Everwell, right?
Yes.
Okay.
Yes.
So if you can't remember that,
go to the old place, go to the new place, come join us on our new adventure.
you're going to end up at the same place. So don't worry about that. All right. Remember, we just started this week having our new feeders webinars. Those are going to be every month from now on. Brian's going to be running those. It's going to be great. And so you can get over to rawdogfoodandcompany.com. We're going to help you dispel the complete and balance myth, itchy pets, how much to feed, what to feed, when to rotate, all that kind of jazz. So head over there to our website, rawdogfoodandco.com. And remember, if you're confused, you can sign up for a perfectly free 20-minute consultation. Or if you prefer not to speak to anyone because you don't like people, just take our quiz. We have a quiz. That doesn't ever happen. Nobody ever gets tired of people.
I was like, what? Oh.
Okay, everybody. Thanks so much for joining our podcast today. We are here every week. Tell your friends. Push our podcast out if you think it's informative, which we do, don't we, Dr. Andi?
I think it's awesome.
I think we're, fabulous. Okay. All right, everybody. Thanks so much. Get over to rawdogfoodandcompany.com where your pet's health is our business and we're friends. Don't let friends feed kibble, right, Dr. Andi?
Right, DeDe.
Okay. We'll see you next week. Bye, everybody.